When we thought of developing this program, we wanted to bring a good experience to the medical students, so that they went all over the world and learned about other cultures, other languages, other healthcare systems, and experienced the way patients are seen, treated, diagnosed in different cultures and different countries. So when students come back to practice here, being in a different country will help them deal with many of the issues that they actually face.
The Global Health Steering Committee is composed of students and faculty, and basically it coordinates all of the global health related efforts at Robert Wood. And so what we do is we are involved with lectures as part of IHIG, which is a club. It's a non-credit elective for first and second year students, and we also get funding so that students can travel abroad, mostly for students between the first and the second year during the summer, but also for third and fourth year students.
Aparna Kalbag. I'm a postdoctoral fellow in the Office of Global Health with Dr. Javier Escobar. And my job in the office is to meet with students with Dr. Escobar when they come in to talk about their interest in global health rotations. So we usually do an orientation for first year students here at the medical school, and then we invite students in for individual appointments with Dr. Escobar. Our role is really to help students find the best educational rotations, either in their first year, or many of our students also return to global countries in their third and fourth year to be able to get more hands-on clinical experience with diverse populations. So many of our students go to diverse places. Many of them are very enthusiastic and find their own programs to go to. So for example, we have one student who went to Nicaragua, and I think part of what they are able to do is, what they talk about is actually how much they learn from the other culture in terms of how to use resources in the most efficient way in resource-poor countries. We have other students who've gone to resource-rich countries, for example Spain, where students have learned about electronic medical records. So what we're finding is that as students go abroad, they're actually bringing back knowledge for them to use in their practice and their education here in the U.S.
I spent 6 weeks this summer in Keynote, Nicaragua, which is a city about an hour southwest of Managua, the capital. The first 2 weeks I was working in public health centers, both in Keynote and then also in more rural communities outside. And then the last 4 weeks I was in the regional hospital, Hospital Regional Santiago de Keynote, and while I was there I rotated between labor and delivery, the pediatric emergency room, pediatric inpatient, and surgery, and I was concentrating on looking at aspects of pediatric care. I think the important thing about global health is, obviously it's great to see other communities, but it also makes you think about where you come from, and it makes you realize the resources that we do have here, and also helps you understand sort of how to have this more creative thought process about getting around different problems.
I think it will keep growing from 50 medical students that we have now going abroad. We are hoping to be able to offer this to hopefully 60-70% of our students. Also, we like to develop new collaborations in research and education with many other countries, so that we not only we send our students, but also we could get students from those countries coming here.